Hello and welcome to our discussion of policy and environmental intersections of health and community development. So today we'd like to talk just generally about how health and community development kind of fit together, and perhaps even more importantly for Main Street and on-track communities, what kind of policy or environmental changes can happen in communities that lead to improved health and economic and community development at the same time. So sometimes we tend to think of these things in silos, and for years and years, planners and public health practitioners and others haven't necessarily worked together well to say, here are solutions that impact both the economy and health. But we want to go through a few examples of how public health has developed over the last 10 years or so, and then give some real tangible examples of in West Virginia and elsewhere, what kind of steps have people taken to try to do this. The purpose of this presentation is really to kind of help you think as you craft your applications for growing healthy communities, or you start to think about how to evaluate projects, or how you start to think about how this economic development project might fit with health, to kind of help you put these pieces together so that you've got a much stronger grant as you move forward. So this first image that you should be seeing on your computer screen now is the socio-ecological model of health. Sometimes we refer to these as the social determinants of health. But and you can see that this was, we're moving into about 25 years almost since this image specifically was made. But public health has started moving away from this idea that we need to go out and we need to affect individual lifestyle factors or individual people, and started trying to look at some of these parts of the diagram that are further out. So, in the past, one of the things that public health has been guilty of doing is going person to person and saying, you need to eat healthier, you need to exercise more. And that takes a lot of resources to go from person to person, but it also doesn't have as big of an impact. So one person might listen, another person might not. But even more so, we've started to realize that there are other things that impact people's ability to live healthy. And so as you go out of this diagram a little, you're going to see there are social and community networks, so the people that you interact with, things like social capital that impact whether or not you're going to be able to live that healthy lifestyle. Even if you know that you need to eat healthy, you're able to do that. Your living and working conditions, so those are starting to get into policy area things, which are obviously going to affect your health. So where you work, what kind of environment it is, what kind of education you have, what kind of agriculture and food production, food availability, healthcare services, the housing, your employment status. All those things are going to impact health. And then, on the very far outskirts of this diagram, general socioeconomic, cultural, and environmental conditions. So if I tell you to go out and get more exercise, but you live in a neighborhood where there's no sidewalks, there's no access to anything, it's a place where you really can't get out and get exercise, then you're not likely to follow those instructions, whether it's from a physician or from a public health practitioner. You might know that that's something you should do. Or if you're worried about, your job or how you're going to get your meal from day to day, you might go get fast food meal. You might not be worried about, what's the healthiest. You're worried about what's the cheapest and what do you have access to the easiest. So we have to address some of those outside conditions. And so I think with growing healthy communities, what we're going to see is that there's some ability to actually address these kind of policy areas to try to improve economic development. But in the same sense of doing that, you're also going to get some health impact. The next diagram is kind of a different way to look at this. This was from an article by Thomas Frieden, who now is the director of the CDC currently. And it's a similar look, but it's kind of flipped upside down. So the smallest impact are things like counseling and education, those things I said that public health was guilty of, saying go out and eat healthier, be more physically active. They have an impact, and sometimes they have a bigger impact, but they're usually, even when they have a larger impact, those things are usually short-lived impacts. So they're things, if I go out and have a campaign, say walk more, walk more, walk more, people may do it. We might see short-term changes, but in the long run, is it really sustainable if we don't look at other things like the environment in which people make choices? Moving down that pyramid, you're going to see things like clinical interventions, so prescriptions. Again, it's individualized. And then you're going to get into a little bit more impact with things like immunizations, right? So if we immunize populations, we see less incidence of disease, and those things are going to be longer lasting, protective. The next one down is the one I think that your grants in the Growing Healthy Communities program are really going to impact. That's changing the context to make individuals' default decisions healthy. So some examples of that, some very highly successful examples that we've had in public health are things like water fluoridation. Adding the fluoride directly to the water has seen a lot of gains, especially around dental health. Iodization of salt, smoke-free tobacco laws and taxes on tobacco. Those types of policy levers are really where you can start to make a difference in allowing people's healthy choice to be the default choice, right? So as we raise tobacco taxes, although it's controversial, obviously, I realize, as we raise those taxes, it's easier for people to go, okay, I'm not going to go out and purchase cigarettes. If we say you can't smoke indoors, especially today, as I'm recording this, I think the weather outside is about 3 degrees. So, as you have smoke-free laws indoors, it's less likely somebody's going to take the effort to go outside. So you at least are going to reduce some of the impact of tobacco smoking. So, I think that's where we really want to look at. And obviously, I think a lot of your grants, being economic development grants, will probably have to do with physical activity and nutrition. So we're going to see some examples of that. But let's talk a little bit more about this context of policy and environmental change. There are many contextual factors in the environment that influence individual behaviors. And so again, clean indoor and no smoking rules, those are really highly recognizable examples. Another good example of ways to influence individual behavior through policy and environmental change are physical accessibility laws and modifications to allow access to individuals with disabilities. Things like the Americans with Disabilities Act, they allow individuals that have these disabilities to actually have access to facilities to be able to go out and be a normal part of their community without inhibiting them from living that lifestyle. Food handling and safety rules and regulations, that's one that you're probably familiar with. We go in and we do food safety and monitoring of places like restaurants and others, that we can go in and make sure that there's things are being handled right, or even on a larger scale in the food production. We go in and we actually are going to monitor that, and so that has a large impact on health, because you're changing that bigger environmental structure and not just the individual level, and going around saying, don't eat things that are bad for you, don't eat things that might have bacteria. Workplace incentives for employee fitness, internal rules, making healthy options in a workplace cafeteria, right? So that's a big one. If you are at work and you go down to your cafeteria to grab something to eat and everything's unhealthy there, you're going to eat unhealthy. You don't have the option to even have healthy options. So making those types of choices available. And then a final example would be something like flex time or infrastructure support, having a dedicated nursing room for breastfeeding employees. Those kind of things are very important to help influence healthy behaviors. So one example from West Virginia I want to give is this Change the Future West Virginia. And Change the Future West Virginia was a CDC-funded project. It took place in the Mid-Ohio Valley region of West Virginia in the 6 counties over there around Parkersburg. And basically the CDC wanted that region to focus on policy, systems, and environmental change. And so many of those developmental initiatives that were undertaken by Change the Future overlapped with economic development. So we want to talk about some specific things they did over in those 6 counties, how they might have had both a health impact but also this economic impact. So one of those is complete streets. And in this sense, I want to use a rural complete streets. And I get a little flack sometimes about this image because it doesn't look like the most inviting, but it is a complete street. And so in rural areas, if you lived over here towards where the picture's being taken, and the downtown or the business area was down towards the other end, this complete streets gives you an opportunity to actually access those businesses. So you can imagine the economic development drive there, right? It's easier for you to walk. But then again, there's also a health side. So instead of just getting in your car and driving down there, you're more likely to walk down there. and purchase things. And so there's this interaction that you're beginning to be able to see between the economy and health. And so this is, again, an example of a complete street. And complete streets, if you're not familiar, are policies that are passed that say anytime any kind of infrastructure improvement is undertaken, you'll at least think about the usage of that road or sidewalk or whatever it is by bicycles, by pedestrians, by cars. And so you're going to think about all modes of transportation, and to the best of your ability make streets complete so that you have access there by both the pedestrian and bicyclist, but also by public transportation, by the driver. And so it makes you think about what's the potential impact of health here. Convenience store initiatives. These were very interesting initiatives that took place over in the Mid-Ohio Valley. Basically, at the start of the grant, we went in and we looked at all the convenience stores, and I want to say it was about 17% of the convenience stores in the Mid-Ohio Valley sold fresh fruits and vegetables. So a very small amount that actually sold the fresh fruits and vegetables. And so the Mid-Ohio Valley had just come out of this kind of controversial smoking ban. As you know, a lot of counties had controversy with smoking. So in these six counties, they had just banned indoor smoking in bars. And so the health director at the time was a little bit hesitant to go in and say, okay, we're going to force you to sell fresh fruits and vegetables, and was instead looking for some kind of incentivized way to get convenience stores to sell fresh fruits and vegetables. And so the idea they came up with was these convenience stores had to sell had to pay a food service permit, so a food inspection or food handler's permit if they sold any kind of food in the store, and they had to pay, I think it was $50 per cash register for that food service permit. And so if you were a small store and you had 3 cash registers, it might be $150 a year, which doesn't sound like a lot, but the health department said, you know what, we'll waive for each fresh fruit or vegetable that your convenience store sells, we will waive 20% of that fee up to 100% if you sell 5 or more. And the convenience stores absolutely love this. Even though it seems like a small amount, they like this idea, and then so that we gave them these little stands that they could feature, fresh fruits and vegetables. Some of them already had space that they wanted to use. And then they started finding out there was a large profit margin to it too. So for a convenience store, you can imagine if you sell a banana for $1 a piece or something, there's a large markup on that, and so you could make a lot of profit. But it also gave healthy options, and so we had people that were in the paper saying, oh, this is great because now when I stop at the convenience store, I have access to these healthy and fresh fruits and vegetables, and I'll actually eat that for my lunch. So it was really a win-win for everybody, it seemed. And so at the end, we went back around to all the convenience stores, and we went from about 17% of the convenience stores all the way up to 81% of the convenience stores in that 6-county region were selling fresh fruits and vegetables by the end of the grant period. So it was an overwhelming success. And I think that's a great example of this intersection of community development or economic development and health. Another initiative similar was our grocery store initiative. So, as you check out in a grocery aisle, this is the checkout aisle, and you can kind of see the conveyor belt there where you put your food up. When you check out at a grocery store, there's all this junk food, candies and that kind of stuff. If you have kids, they're always trying to grab into the candy bars and stuff, take them with them. So one of the other ideas we had was, what if we were to transform, at least one of these checkout aisles into like a healthy options? And so I believe this one was taken in a Foodland. Foodland in the area and also Walmart actually in the area were very big participants in this initiative, and they put these healthy checkout aisles in. Another example where it seemed to work all the way around. It felt like the store managers and owners felt like this was a very successful. It was driving upping profit. But also people, the newspaper interviewed people who said, well, I'll rush in here real quick on the way to work and I always get something from the checkout aisle. This is great that I've got better things to pick from, salads or dried fruits or whatever they might be. So again, it was a very good initiative over there that worked out well. There's also one thing that Growing Healthy Communities has focused a lot on. I've noticed from some of the past projects have been things like trails and bike paths and connectivity. So another example from this Change the Future was this Ruth Looney Trail. So they kind of just finished this trail that went down from, I believe it went from the post office in Grantsville down to the health department, and it goes down through the woods. It was very pretty. And people started walking, so instead of getting their cars and making the long drive around to the post office, they could just walk back and forth between the post office and the health department. So it just gave them, the ability to access these things at the top of the hill. They could walk up there for lunch. They could walk up there to the post office, and it was easy to get back and forth between the office that way. And it was healthier for them to be able to walk up that way. These are again good examples of ways to improve connection, improve health, and perhaps if these are strategically located right, they're going to connect people to things that can drive economic development as well. Farmers markets, a classic example. You've got healthy foods at a farmers market, but you can also drive economic development through those farmers markets through sales of fresh fruits and vegetables, especially local farmers who are going to reinvest some of that money in the economy. One of the things that we do here at WVU that's nice is outside of our office we actually have a farmers market that we can go to on Wednesdays in the summer. So at lunchtime you can go out and buy some fresh foods and eat them, and it's a lot healthier, and you get some exercise to walk around, and also again generates income for the local economy. Bike racks. These bike racks specifically were made to promote healthy eating. So you see the carrot over there that was just to get people thinking about healthier things, but also gives you a place to put your bike. This was in downtown Parkersburg, I believe. Other ideas outside of those were all Change the Future West Virginia, but another idea might be something like an arts walk, right? So some cities in West Virginia now I think do monthly arts walks or quarterly arts walks. In Morgantown we have an annual one. But just being able to have things out for people to look at, destinations for people to go to. You can't underestimate the fact that people will say, well, I don't walk or bike to downtown because there's nothing to do when I get down there. So having these kind of events, just to, even if it just to raise awareness of the existing businesses, so you put some of the art in the businesses, so people can walk up and down your street and look in there and see, what's there and what's for sale. They can be very good ideas for generating economic development, but also giving you that health component. The next one that I've been criticized a little because in my photo the food's not very healthy, but I still kind of like it because it looks very kind of, to me, West Virginia meal. So there's you could have this idea of like pedestrian or bicycler discounts at restaurants. So you say, okay, if you ride into town or you walk into town, you can have a 10% off of your bill, or you can have a free glass of wine if you walk into the restaurant. There's kind of partnerships with downtown business to get people to do it. That's an interesting idea that I think could be explored some. Another thing that's happened is this idea of a red swing project. So it's taking these areas of town. This is, I believe, an interstate overpass that was done somewhere nationally, and then just putting some space down there for people to be able to actually utilize it. And we have a really negative connotation, I think, sometimes of what goes on under bridges, with drug use or whatever. But being able to revamp that space into something that's a little bit nicer or usable for the community. Again, here's actually a picture of that farmers market I mentioned earlier, but this could take the form of something like a lunch stand, of a local business that was offer a lunch outside of a business that, a larger business, so that they could offer that something healthier to eat. Again, is going to have that kind of impact on economic development and health. So I know that was a brief, little 20-minute introduction, but it's just I'm hoping a way to get you thinking about here's the different intersections between things that we could do that drive economics, but also have this health component so that they blend together. And I think moving forward, the key takeaway is both as public health researchers and practitioners, but I'm hoping as we get involved in communities that planners and city managers and city councils and local policymakers and even legislatures will start to understand that these things don't stand alone. So as you develop economic development, you're going to have this health component that you can always keep in mind and think about. So thank you for your time.